Hi, welcome to 10-minute discussion on the brain vascular system, and today we are discussing the internal carotid artery, the cause of the internal carotid artery as it ascends to the brain, but the branches of the internal carotid artery will also be discussed here. So join me as we are going to explore the journey of the internal carotid artery. Yeah, so we discussed we like in the previous video we already saw how the internal carotid arteries is formed from the common carotid artery by bifurcation of the common carotid artery into internal and external carotid. So the internal carotid will continue to travel in the carotid sheath, and then it ascends in carotid sheath. So the internal carotid artery can be divided into four parts. We can have the part before it enters the brain, the bones of the skull, and that part will be called the cervical part because it is present in the cervical part in the neck. And then after entering the bone, we have that part that travels in the petrous part of the temporal bone. So that part will be called the petrous or the petrous. And then after petrous, now this is the this is the petrous part. And then after petrous part, it goes the carotid. It goes to the cavernous sinus. And so we have the cavernous part of the internal carotid. We're going to see shortly what the cavernous part is. And then after that, it goes now to the brain. So we have the brain part, which is known as the cerebral part. So we have essentially four parts, but don't worry about these parts at this point. So the internal carotid artery goes through the carotid canal as it enters the cranial cavity. So it enters through the carotid canal. So the carotid canal is a canal, so it's something like a tunnel. So it has got the external opening, the internal opening. So this is the external opening of the carotid canal. And I tell you what, the internal carotid artery supplies two crucial structures, and that is the brain and the eyes. But I would say the internal carotid artery was designed to supply the brain, but it has an exception that it goes to supply the eyes as well. So we see what branch goes to the eye from the internal carotid artery. So let's take a look on the cavernous sinus. As I've told you, we have the cavernous part of the internal carotid artery, and this is what cavernous part is. So I will take you back to this slide. Like you see, after entering, it goes like making a curve. So it goes anterior, and then it curves backward. So if I cut somewhere here, like in coronal section here, I will cut this internal carotid artery at 2 points, and this is what we are seeing here. So the internal carotid artery is cut into 2 points, this one, and this is in cavernous sinus. But in this cavernous sinus, what I want you to appreciate, what I want you to pay much attention on is the relationship between the internal carotid artery and the optic chiasm, and the internal carotid artery and this little nerve here, which is abducing nerve, cranial nerve number 6. So this is very, very much important, as we know, when we have something like aneurysm. So we have aneurysm of the internal carotid artery, for example, at this part, it will compress the abducing nerve, and it depends on which side is affected. So whether it's the left side or the right side, we have bilateral internal carotid artery, and so we have bilateral these abducing nerves. So bilateral abducing nerve and bilateral internal carotid. So it depends on what point has diverted, depends on what point has aneurysm, it will affect it and will have different clinical presentation. So we also have, you can also see, we already saw this relationship between the optic chiasm and the internal carotid artery, and we know that if we have bilateral aneurysm of the internal carotid artery at this point, we like compress the temporal fibers from either eye, and then someone will have a binasal myopathy. I think you remember about that one. All right. All right, so that is it. And then this is the internal opening of the carotid canal. So in case of aneurysm, the very first part to be affected would be the abductor nerve, which is cranial nerve number 6. So let's now talk about the branches of the internal carotid artery. So the internal carotid artery has got no branches in the neck. The cervical part of the internal carotid artery has got no branch. The branches, they start after the internal carotid artery has entered the cranial cavity. So the cranial part, or the cerebral part, is what actually got the branches. So the very first branch, we can term the very first branch as the ophthalmic artery. The ophthalmic artery, we can think of it like as the very first branch of the internal carotid artery. And as I've said, the internal carotid artery was designated to supply the brain, but it gives one branch that does not go to the brain, and that would be the ophthalmic artery. And ophthalmic goes to the eye. Ophthalmic artery goes to the eye. So it also gives a crucial artery here, which is the central artery of the retina, that enters the optic nerve, and then it travels to the globe. It travels to the eye, supply the retina. It also has some other branches, but that's not our problem at this time. And then we'll have another branch that we cannot see from this picture, but I will show you shortly. We have the posterior communicating artery. This posterior communicating artery is the branch of the internal carotid artery that goes to connect the anterior circulation and the posterior circulation. We are not yet sure about the posterior circulation, but we in 2 videos to come we know what the posterior circulation is. But this one is what connects the anterior circulation and the posterior circulation. It is a branch of the internal carotid artery. We have some other literature that says it is the branch from posterior cerebral artery, but for the matter of this discussion, we term this as a branch of the internal carotid artery, and we'll have some references about that one. Okay, so let's see other branches of the internal carotid artery. So the internal carotid artery, it terminates by forming 2 terminal branches, and that will be the middle cerebral artery and the external cerebral artery. So the middle cerebral artery and the anterior cerebral artery. The middle cerebral artery and the anterior cerebral artery. But before it gives these 2 terminal branches, before it terminates, it also gives one branch which is known as the anterior carotid artery. So it's not seen from this picture, but I will show you shortly what anterior cerebral artery is. So that's the 2 terminal branches of the internal carotid artery, the middle cerebral artery and the anterior cerebral artery. So in summary, these are the the brain parts, the brain branches of the internal carotid artery, and we can see this is the internal carotid artery. So the internal carotid artery will give this posterior communicating. Remember, now we cannot see ophthalmic artery because it has gone to the eye, and now we are dealing with the brain. So we have this ophthalmic the posterior communicating artery, as we can term as the first branch if you forget about the ophthalmic artery. And then it also gives another anterior carotid artery here, and then it terminates by forming 2 terminal branches, the anterior cerebral artery and the middle cerebral artery. But the middle cerebral artery is the biggest of these 2 terminal branches, and you can all appreciate that this is very, very bigger compared to this one. So all these, the internal carotid artery, you can see, you have bilateral internal carotid artery and they supply on either side. So we can say like this, the internal carotid artery will supply the anterior circulation. This is what forms the anterior circulation. To the point of this one, posterior communicating, all this posterior communicating. So all this part, maybe all this territory is the territory of the internal carotid artery. Is the territory of the internal carotid artery. So that was it from the internal carotid artery, and I hope it makes sense. Next time we'll discuss about the brain, about the cerebral, the next time we'll discuss about the major cerebral vessel, no, the posterior circulation by the vertebral artery. So see you next time. And that's a mnemonic. That's a mnemonic for remembering all these branches of the internal carotid artery. And see you next time.